When it comes to later stage, more progressive lymphedema that's a little bit harder to treat and you've already been through a full course of complete decongestive therapy, I do have a few tips and tricks up my sleeve that seem to be making long-term management a little bit easier. Using a combination of both positive pressure and negative pressure seems to be helping my patients significantly more than regular maintenance therapy alone. Now, what do I mean by positive and negative pressure? Well, positive pressure is any pressure we elicit on the skin. So even if it's very gentle, like manual lymphatic drainage, or adding a little bit of deeper tissue work, anything where we're pushing down or along the skin and tissue is positive pressure. Negative pressure is anything we can do to open up this tissue space. So anything that will create more room in our skin and subcutaneous tissue layers to allow for better fluid movement. My name is Lisa Sylvestri. I'm a physical therapist and a certified lymphedema therapist, and my goal is to make us all lymph smart. So stay tuned to the full video for my how-tos on how you can do this independently and successfully on your own long term. When it comes to increasing positive pressure on the limb, there are a lot of different manual techniques that your therapist can utilize with his or her hands to manipulate the tissue and perform deeper work in order to soften that tissue. But that might not be reasonable for you to try or perform on yourself. So something that my colleagues have been talking a lot about at recent conferences and performing small case studies on is the increased utilization of foams underneath your pneumatic pump at home. So here we have a Juzo soft compress roll, and here we have a Moviderm small block roll. And both of these could be used to wrap around the limb, and then you'd simply put the limb inside of your pneumatic pump at home. Another thing my patients have tried, if you don't have access to these foams, but you already have a night garment, is putting your night garment on inside of your pneumatic pump as well. Now, some are bulky, some might not fit well, or you just might not like the feel of all of that on your arm. That might be too much pressure. But if you have both and you want to give it a try, speak with your own medical team to make sure there's no reason why you can't do that. And then you can increase the positive pressure in your pump that way. You can start right on the foot, very loosely and gently wrap this up the leg. There's no right or wrong way to do this. This is obviously a bigger, longer piece of foam, so it's going to be appropriate for the leg. There are different sizes of all these foams and pads available. A nice loose layer. Then I would put the whole leg with the padding on it inside my pneumatic pump, hit start, and enjoy my hour of relaxation with the additional positive pressure on the leg. Now I'd like to show you a few of the ways that I utilize elastic taping in the management of hard to treat lymphedema. Now this tape utilizes negative pressure to open up that tissue space to better allow fluid movement within the tissue. So I always utilize the fan technique or the octopus technique, depending on your age. I've already pre-cut these. I've cut 4 legs, if you will. I've rounded the top and I've rounded the bottom. I love the elastic tape that has the markers on the back. It just makes it a little bit easier to cut straight lines and to cut relatively even widths of each leg, but it does not have to be perfect. Now what I'm going to do first is show you the one octopus that I've cut with 5 little legs, because this is how you can use it on your hand or your foot, because we often get a lot of swelling on the top of the hands and feet, even into the toes and fingers. So first what I'm going to do is just detach the tape at each one of the little legs. I'm going to attach this at the top of the ankle. So I want to be able to cover the joint where we're getting the movement. So I'm going to pull the top of the head off of my little fan or octopus, and I'm going to place it right above the ankle joint. And I'm going to stick it down, rub it a little bit to get some heat, right? So we can activate the tape. And then I'm going to take my first little leg and using paper off tension, I'm going to place it down the foot. But in the meantime, I'm pointing the foot down, including the toe. So I'm going down, 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 down. Now I got to go fast because I'm getting a cramp in my foot. And all the way down the toe. Woo! You're not pulling too much. You can always adjust pressure, and this is definitely something you want to work on with your own therapist, but we're going to do the same thing down each subsequent toe. So now once this is all on, every time you move your foot, you should be getting wrinkles in the skin. And that's how we know the tape is actually pulling on the superficial layer, opening that skin up. Now the next piece of tape we're going to utilize is for thickness into the lower leg, and again further down into the ankle, because a lot of times it's the swelling behind the ankle bone that gets really irritating to patients. Okay, so I'm going to rip my little legs again. And if you remember our lymphatic anatomy, we know that the lymph vessels come up the inside of the knee, so that's where I'm going to anchor my little octopus this time. And activate with some heat. I'm going to point the foot down as I go down the ankle bone with my paper off tension. Now for swelling and thickness behind the ankle bone, I'm going to apply the tape with paper off tension, but I'm going to flex the foot up as I attach it to the skin behind the ankle bone. So paper off tension. And I'm really going to guide it behind this ankle bone now. I'm going to try and go a little bit further up now. And I would do the same with the next two pieces. Going around to the other malleoli or ankle bone. And now again, you can see that as I move my foot and ankle, I'm creating all sorts of wrinkles behind this ankle bone and at the front of the ankle bone as well. So this would mimic the motion I perform when I'm walking or performing any exercises utilizing my feet. And it's really going to help promote fluid movement by utilizing the negative pressure. And for my last tape application, I'm going to show you something that can be utilized for tricky and thick swelling right along a joint, so the knee in this case. Principles of taping: you always want to put the head of the fan or the head of the octopus closest to the lymph nodes that you're traveling to, so up towards our inguinal lymph nodes. You don't have to go all the way up to the lymph nodes themselves, because in theory the elastic tape is pulling the fluid up towards that area. Now what I'm going to do, I'm going to turn around a little bit, and I'm going to keep my affected knee bent as I do my tape off technique. I'm going to just pull down this way. But what I want you to see is as I get closer to the back of the knee, it's okay if tape overlaps, I'm going to straighten my leg a little bit more, continue with my paper off tension, ending in the area of the leg that has the thickest amount of swelling. And I'm going to take this last one even further down, and now I'm going to cross this joint. You can see there's a little bit of area where the tape isn't stuck down, and I'm going to straighten my leg, stick it down. So now when I bend and straighten my knee, you can see the wrinkles in the skin and then in the tape. So again, the more you use your muscles for exercise, the more the tape is going to work with you and in your favor to help control that really thick, hard to treat swelling. I thought I'd just give one example for upper extremity swelling when you have really thick fluid in the forearm area. So you're going to attach the top of your fan or octopus above the elbow. A little heat to activate it, make it stick really good. Take the first leg off. Now I'm going to bend my elbow a little bit here. Again, just put it down into the forearm. This one's really long, so it's going to wrap all the way around to the wrist bone, which is just fine. I'm going to do the same. I can find the end of the second leg. There it is. Keep the elbow bent, kind of bypass that elbow area. Tape off tension, down the arm, maybe into the top of the hand area. I'm so not left-handed, as you can see. This is more difficult, but practice makes perfect. Activate the end with a little heat, make it stick really good. We're going to do the same thing for 3 and 4, keeping this elbow bent just a little bit so that you don't go straight down onto the elbow. All the way down onto the top of the hand, which can also be a hard to treat area. And last one here. Maybe. Last one here. Again, bypassing that elbow area. And then paper off tension, trying to keep it somewhat straight here over the wrist area. You can go longer, you can go shorter, whatever you decide. And now I'm going to straighten the elbow in order to flatten all of this tape down. Now, as you can see, when I'm bending and straightening the arm, I'm really getting a lot of wrinkling in the tape, which means the tape is doing exactly the job that I want it to do, right? It's opening up that space in order to allow for more fluid movement out of this thick forearm area. Now, the final method I like to utilize for really thick and hard to treat swelling is negative pressure with a cupping device. Now, I like these handheld devices, which are really easy for patients to utilize at home. I love this little handheld bulb where you can control how much pressure you get. The harder you press the bulb and let go and release, the further it sucks the skin and tissue into the bulb itself, creating that negative pressure. So when we're performing this negative pressure technique, it's not like traditional cupping where we're trying to get that real red area. We're gonna slide along the leg or the arm or trunk or wherever you're trying to treat. And I love to use lotion to do this. So make sure you're using one of the recommended lotions from your medical team and just apply enough so you can get a little bit of slickness on the skin in order to slide. And now you're gonna apply your lotion to get a nice slick surface for this to move on. I always apply my lotion in an upwards direction. Now, just like you would do at home, you're always going to clear the thigh or upper leg first before you move down to the lower leg or the foot and ankle area. So you're gonna put the cup onto the skin. You're gonna push the bulb and release to whatever is comfortable. I would start really low and then slide up towards the lymph node area. Now, as I do this, you may see a tiny bit of a color change in the tissue, but just about as soon as I'm done, you're gonna notice that it goes away. And a tiny bit of redness to the area is okay, but if it hurts or there's too much redness, simply release less, get a different type of negative pressure device that can actually measure the pressure, and you're really going to what feels comfortable and beneficial for you. And you can do this all over the top of the leg and the thigh. Make sure you're pulling to what's comfortable, and see, when you don't apply enough lotion, which I didn't apply enough to the outside of the leg, you won't get that sliding, and you really want to go for the slide because then you're keeping the lymph capillaries open the entire time you slide up the leg towards those lymph nodes, and you're really getting the max benefit of this technique. And then you can simply do this through the remainder of the leg all the way up. If it's easier for you to do this with some help, don't be afraid to ask. You can see that the tissue pulls up into the cup, and you should be able to use not too much strength just to slide it up the tissue. Do what's comfortable. These devices come in different widths, so I like the bigger ones for the bigger areas such as our legs, trunk, upper arm, but you can get really tiny ones that will work just as well behind the ankle bones. It's a little bit harder around really bony prominences like the foot, but when you're really swollen, if you do some cupping and then apply your taping, hopefully the swelling will go down and become less thick before you know it.